Today, the Health Sciences Authority has announced that it has granted authorization under the Pandemic Special Access Route for the Pfizer-BioNTech vaccine. This regime requires 2 doses of vaccination administered 21 days apart and is recommended for individuals above the age of 16 years of age. This is part of the government's process to stringently assess the safety of COVID-19 vaccines that we bring in and ensure that they comply with all international standards on safety and efficacy. And only vaccines that meet the strict standard of safety, quality and effectiveness will be used in our population. The review process involved rigorous reviews of laboratory and clinical data, and they have been reviewing the available scientific evidence in detail to ensure that all regulatory requirements and standards for safety and efficacy are met. This is similar to what its counterparts in the US, the UK, the European Union, and the WHO have in place. Since October, the Ministry of Health has also set up an expert committee on COVID-19 vaccination. And the expert committee has also reviewed the vaccine safety and efficacy data. They have been briefed by the Health Sciences Authority on its full considerations in granting interim authorization of this particular vaccine and agree with the recommendations that the vaccine should be suitable and given to individuals above the age of 16, but not at this time recommending the vaccine for pregnant women, immuno-compromised patients, and those below the age of 16 due to the need for more data to emerge and be subject to that stringent evaluation process. They further recommend that Singapore should achieve as comprehensive a coverage as possible among its population. And as such, they recommend that all Singaporeans who are medically eligible for the vaccine should be vaccinated. And the Ministry of Health has accepted the recommendations of both the Health Sciences Authority as well as the expert committee for the coronavirus vaccination. The Health Sciences Authority will continue to actively monitor the safety profile of the vaccines and track for adverse events that are associated with this vaccine, either globally or locally. And this will allow us to react quickly if we need to manage any safety issues that might arise. As a result of the recommendations coming out from the expert committees as well as HSA, we encourage all Singaporeans to be vaccinated as long as you are within the eligible group as recommended, so that you can protect yourself and we can achieve a high level of protection nationwide. Vaccination is one of the key enablers that will protect us and our loved ones against COVID-19 infection and allow the economy to open up for social activities to resume. And having this community immunity will help us to be able to safely and quickly return back to normalcy. And we encourage, therefore, everyone in Singapore to take up the vaccination when it is offered to you. Further assessment of the long-term data will continue to ensure that the immunity that is conferred is long-lasting and to determine the proportion of the population needs to be vaccinated in order to develop immunity to the COVID-19 virus. And therefore, we will continue to review that data and to decide whether these recommendations need to be adjusted along the way. We have acquired sufficient doses of the vaccines for all Singaporeans and long-term residents in Singapore. The securing of access to COVID-19 vaccines occurs through a broad and diversified portfolio and strategy to ensure that these vaccines will come into Singapore in a timely fashion for vaccination of the population. The first shipment is due to arrive in Singapore at the end of December, and the stocks will continue to arrive over the coming months. We do expect to receive enough vaccine stocks to allow for the entire population to be vaccinated before the end of this year. So everyone will have a chance to be vaccinated, but as the global vaccine supply is limited initially, while manufacturers continue to ramp up their capacity, we will need to prioritize those at risk and most vulnerable for that infection. And therefore, we wish to vaccinate those who have these high risks. In our plans, we intend to provide vaccination progressively, first protecting those who need this vaccination the most. And these would be the healthcare workers and frontline personnel most at risk of becoming infected with COVID-19. In addition, we wish to vaccinate as a priority the more vulnerable groups at greater risk of severe symptoms if they were to become infected with the COVID-19 infection. And this is consistent with the WHO's recommendations for vaccination. Further details will be provided as we operationalize our plans for vaccination, and further announcements will be given to allow you to understand what your priorities are and when these vaccines will be provided. Vaccination is not a silver bullet that will immediately end the pandemic or the outbreak that we experienced in Singapore. Safe distancing and safe management measures continue to be critical until such a time when sufficient numbers of our population are protected. The COVID-19 vaccine will expedite our recovery from the pandemic, but it is going to be some time before the world returns to a pre-COVID normalcy. The key is not to let our guard down and to let our painstaking efforts in the past few months go to waste. We need to continue to be socially responsible, wearing a mask when going out, and seeking medical attention if ill, and getting tested if we have these symptoms suspicious of COVID-19 infection. And if we can stay vigilant, we will emerge from the pandemic stronger and more united as a nation. Thank you.